Excellencies, ladies and gentlemen, friends. I'm Marianne Claesson, the GFF Global Financing Facility Director, and it's my great honor to invite Kristalina Georgieva to give the opening remarks. Kristalina, you are our CEO at the World Bank, and everybody knows you, so it doesn't require any further introduction. But I do want to take this opportunity to thank you. We wouldn't be where we are in the GFF on this journey if it wasn't for the support, commitment that Kristalina, the CEO at the World Bank, has shown to women, children, adolescent health and nutrition. So thank you.
Thank you very much, and good evening to all. It is very easy to have this commitment. I'm a mother and a grandmother, and I want my daughter, my granddaughter, to grow in a world, live in a world in which men and women are equal, and every child has the right to live in a healthy environment and reach his or her full potential. Very simple. How many in the audience are aware what day is today? Okay, let me hear it. Today is the International Day of the Girl. And I think it is fantastic to celebrate girls with the discussion we are going to have this evening. So from me, since there is a fabulous group of people that you would hear from me just three very short points at the opening. The first one is that it has taken us at the World Bank some time to come to the simple conclusion that the best investment one can make, a country, a family, is investment in people. And that means in the health and education of all. And that in the world we live in, there is still a little bit of shortcoming when it comes down to attention to girls and women, so we have to lift that up more. We are doing it at the bank. This meeting, this annual meeting, is dedicated to human capital, and when I look at the room, very clearly it is dedicated to all of us. We also want to be quite humble when you talk about the conditions in which girls and women find themselves in many countries, mostly in the developing world, but actually also in some rich countries. Conditions that are not conducive to them to be healthy, to live longer lives. We have, on a day like today, we have the horror of 830 women dying from preventable causes related to pregnancy and childbirth. In this one day, more than we have in this room. We are able to send people to the moon, but not able to stop women dying at childbirth. That's not acceptable. So my second point is, what can we do with the Global Financing Facility? What we can do is to very pragmatically focus on maternal and child health, on reproductive rights of women, on family planning. In my heart of hearts, I believe very strongly that this is a mission very worth pursuing. Anybody who follows on the trends in global poverty knows that poverty has gone down in the world, but this decline, now we are at 736 million people, this decline is slowing down, and in a number of countries the trend is in the exact opposite direction. Extreme poverty is going up. And the reasons for this are conflicts, natural disasters, bad governance, but also population growth. And we owe it to women that are not yet enjoying their right to reproductive health that we come through. And that is what the GEF is all, the Global Financing Facility for Every Woman, Every Child is all about. And it does it in a very pragmatic way by using grant financing to make an investment case and guarantee the collaboration of organizations like mine, the World Bank group, with other health programs, and most importantly, with the country's own governments and business community. That takes me to my third and last point. We have something to report and turn to you for your support for the future. We have had so far 452 million of GFF trust fund financing linked to $3.3 billion of funding leveraged from IDA, the International Development Association, and from IBRD. But the most important part is that a very significant boost is given to domestic resource mobilization. And just to give you one example, we had in Cameroon an increase in health-related allocation specifically targeted to women's health from 8% in 2017 to 20% in the budget. Very massive boost. We want to see countries doing themselves what is right, because the investment case is so clear that they have no way around it. Looking into the future, I have three promises to make. One, we heard from you that you want us to be even better in country coordination. We will. We heard that you want us to strengthen the link between the trust fund and domestic resource mobilization everywhere. We will. And we heard that you said that the governance has to be reviewed because every pilot stage requires careful and thoughtful assessment. We will. And we have a small favor to ask you. We will do our part. Please do yours. Thank you. And now I have the privilege to introduce Minister Nikolai Astrup from Norway. Norway will host the replenishment of the GFF on November 6 in Oslo. Nikolai.
Thank you so much, Kristalina, and thank you for your insightful comments as well. Every year, more than 5 million women, children, and youth die from entirely preventable conditions. That is like the whole population of my country being wiped out every year. They die simply because not enough is invested in the health systems and interventions needed to properly maintain their health and nutrition. Babies and children are not getting the medicines and health services they need to survive, to thrive in the early years of life. Women and girls don't have proper access to contraception or family planning services. Expectant mothers do not receive the care they need or the support they require when giving birth, and in the early months with a newborn baby. Not only does this result in more than 5 million unnecessary deaths every year, it also stops many more millions of people from reaching their full potential, trapping communities and countries in cycles of poverty. A woman who has to look after several young or sick children cannot go to school or out to work. This has significant implications for themselves and their families' livelihoods. Children who are undernourished do less well in school and find it harder to get good jobs. The GFF is helping countries to change this. It draws on a range of financing tools that unlock additional investments and in addition help to ensure that more domestic resources are channeled towards health and nutrition. Equally important is how these resources are invested. The GFF works with countries to develop country-specific programs that improve efficiency across health systems. Its data-led approach provides health ministries with the information they need to invest for the greatest impact and to call more effectively for budget increases based on results. Because the GFF is a catalyst, investments go a lot further than they would otherwise and can make a bigger difference to the health and nutrition of women, children, and adolescents. In November, Norway will co-host the Global Replenishment event for the GFF in Oslo. We are seeking to raise $2 billion in funding for the next strategic period. The GFF is only 3 years old, but it is already having a real impact. If we reach our goal to raise $2 billion, it can help countries make far more progress and avoid the preventable deaths of as many as 35 million women, children, and adolescents by 2030. I cannot think of a better reason to come to Oslo in November, and I hope you will join us in making this critical investment in our common future. Thank you so much.
Thank you so much, Minister Ostrup, and thanks to Norway for being such champions for women, children, and adolescents, and for being there from the very beginning of the GFF throughout, a consistent supporter and champion. As Kristalina mentioned, today is the day of the girl child, and that's, of course, a central theme in investing in people. So it's my great privilege to introduce two champions for adolescent girls' empowerment and health and development. Melinda Gates, the co-chair of the Bill and Melinda Gates Foundation, a strong advocate for empowering women and girls to really cause transformational change. And that's what we are about here, trying to transform not just health, but societies. And also my privilege to invite Nurwala Nugrahani to the floor here for a discussion. Nurwala Nugrahani is a leader in Indonesia for girls, adolescent girls, a facilitator and a champion for reproductive health education. So welcome to both of you.
Well, I couldn't be more excited about first of all, the GFF, and secondly, and maybe more importantly, having Bulan with me today. We have long needed a financing facility for maternal, child, and adolescent health. And so to see the change that it's making with primary health care in country is really exciting to me. I want to thank Norway for being willing to host us in November, and also for Kristalina for your strong comments about girls' health and adolescent health, and in particular, family planning. The reason I'm so excited for you to meet Bulan is she is one of the champions of adolescent health, and I'm going to let her tell you her story. But I think the first thing that you should know about her name is that it means blessings of the moon, and I think you're about to find out why. She figured out what her passion was in college. Her background is in public health, immunology, and just to top that off, tropical health. And so, Leone, if you would tell a little bit to the audience, a little bit about your story about what it is that you do as a peer educator and what you're a peer educator for.
So, good evening, ladies and gentlemen. I'm so excited to be here. So, my name is Nurul Nugrahani, and you can call me Wulan. So, besides I'm studying in college, majoring in public health, and majoring in epidemiology and tropical disease. I'm also a volunteer in IPPA, Indonesia Planned Parenthood Association in Central Java. So I'm actually assigned in the Youth Empowerment Officer, where we assist the peer educator in the schools, universities, and communities. But I also love to learn about comprehensive sexual education, where I also be a facilitator in CSE implementation in the schools. And also, besides the peer educator, I also love to learn about comprehensive sexual services, where we are on our way to create the youth-friendly services in primary healthcare in the communities that is connected with the school clinics. So I think that these three, besides of the peer educator itself, I think that these three components of comprehensive sexual education, services, and empowerment cannot be separated. Because, like, first we facilitate the youth to get the comprehensive sexual education, which is like the comprehensive, and after that we refer the youth to access the health services, which is youth-friendly when they need. And after that, we assist them, we empower them to take actions after they empowered. And that's how I love all my works.
And what drew you into this work of really helping adolescents understand their sexual and reproductive health? Why did you get into this work to begin with?
So actually, so when I see the youth, especially those who are younger than me, I can reflect myself back years ago. Like I can see myself in them, the curious me, the high achiever me, and sometimes the stubborn me. But also me, who was at that time being the victim of bullying and body shaming among my peers. Like at that time, it was hard for me to cope with the conditions, but after I found the strength to revive, I started to realize that to be successful in adulthood, like 20 years up, like it really matters what happened in your early age. So at that time, I started to invest my time sitting with my friends, talking about the lives and the dramas, like to be a shoulder to cry on. And even though I cannot always give them the solution, I always enjoy appreciating, like, look at you, like growing, surviving, and look at you, you've come so far and you can do this. I can see the sparks in their eyes, like it gives me positive energy throughout the day. So, and back in schools, peer educator is not popular in my schools years. I don't even know what peer educator is, but once I found Pilar Youth Center in my final years of college, I think that peer educator is important to assist and to empower each other in the peers. I really envy, actually, but I really envy to the students who the school is assisted by Pilar, because to have this such peer educator system. So I really want to take a part to make a change like that.
So one thing that Wulan is too humble to tell you is that she is doing this on a volunteer basis right now. And she rides 45 minutes a day on her motorbike from her home to the base camp where these interns and volunteers work. She's part of a program, not that she goes into the clinics herself, but a mystery client shopper program. And she actually analyzes the data after these mystery clients go into the healthcare facilities. Tell us what you're learning as you analyze the data about whether youth are welcomed or not in these primary healthcare clinics.
So actually, like several months ago, we did a mystery client to ensure how the youth-friendly services So the youth-friendly services is targeted the youth, so the evaluator must be the youth, right? So we encourage the interns in the Youth Pillar Center back then, and they are directed to the 3 districts area, our intervention area in the city, and the scenarios are the same, about the unmarried young girl who just having sexual intercourse last night, the night before, in their fertile cycle. So they ask for help to the health centers in the district. And they go to each health centers, and the result is the 2 health centers accepts their coming, and they are agreed to give them the day after pills to them, and say to them not to do the sexual intercourse before marriage anymore, like that. And the 1 health centers refuse to give the day after pills because of the sins. It's like a bad things to do, and 3 of them experience the health procedures in the registrations basis, because at that time the staff is not sure where to refer them, the youth. Like some of them send them to the even to the maternal and health care, and even one of them send the youth to the head of the health center in person. So it's a thing.
Yeah. Tell me what barriers you all come up against the most in terms of being able to teach. You're passionate about teaching adolescents about their sexual and reproductive health, and also where to get contraceptives or family planning tools. What kind of barriers do you come up against? Like who are the biggest barriers, and how do you move through those?
I think that the biggest barrier is the people, because we are living in a religious community, and we are taught that sex before marriage is a sin. So it's a taboo to come up to discuss about it in public. Then what we are trying to do, maybe we're gonna approach the religious leaders to like give the education to the society that this is the service that the youth needs. You have to provide the service not because of their sin, but based on their needs, like that.
And what do you talked with a lot of adolescents day in and day out, your group does. What are adolescents' hopes and dreams for the future?
Hopes and dreams for the future. So I came recently to a school, and at the first time I entered the classroom, I asked, what do you want to be in the future? What do you want to do after graduate? And the students say that, I want to be a successful person. I want to be useful for the nations, and other general answers like that. And then I asked again, so what is your way? What are you going to do to be successful to your nations? And they become quiet. So I tried to approach them one by one, asked about the same question, and some of them say that, I actually really want to be a fashion designer, or entrepreneurs, or athlete, or mom's blogger, like that. But some of them still don't know what their passionate is. And I try to ask, what is your what things makes you excited? And they say blah blah blah, and I say that yes, you can be it, you can become it, and yes, I can see the sparks in their eyes, So I can assume that once the youth already have found their passion, their life become meaningful with their purpose, with their ambitions.
And how does knowing about their sexual and reproductive health help them achieve their ambitions? What do you say to them about that?
So it's when we are talking about the sexual and reproductive health, it's not we're not always talking about the sexual intercourse, the sexual organ. Now we start to talk about ourselves. In regarding the adolescent, we give them the knowledge about who you are and what you are going to experience in puberty, the emotional change, the physical change, and after that, it's the relation between they and themselves, and after that, the relation between them and their surroundings, and also their relationship between them and with their peers or lovers, like that. So that basic components really helps someone to achieve a bigger state, like that.
It's interesting, when I've talked with youth, they'll often say to me, well, you call it family planning, but we don't call it that. We call it future planning, because they're trying to plan for their futures. And one of the reasons I became so passionate about contraceptives was that we see that if girls can decide if and when to have children, they stay in school longer, right? They get married later. They have the chance to live out their hopes and dreams. So my guess is, Wulan told me that I could tell you that she's 22 years old. My guess is you're probably the youngest person in this room, and if not, close to it. And you came here, you took a flight that took you a couple hours from Sumatra, the island, to get here to speak with world leaders. What message would you like to leave everyone with in the room tonight?
What I really want to say is to become a successful person and the world leaders, like every person in here, every one of us needs to experience a phase called a process. So imagine if this process leading to a successful adulthood started from the early age. Imagine if that youth needs regarding the sexual education and healthcare needs are fulfilled since in their teenage. We're gonna know about ourselves. We're gonna know how about our body. We got to know what is happening in our puberty life. So please, for the adults everywhere in the world, you can sit with us, talk to us, because we need to be listened and encouraged in our teenage. And provide us with education to make us aware, provide us with healthcare and tools to make us growing healthy. And I think that to invest in adolescent health might not produce the direct impact, but we can see like 10 years later, like you can see the youth, us, can be the world next leaders. We can be healthy and might be contributing and reducing the rate of unwanted pregnancy, the early marriage, the STIs, and HIV and AIDS. We have passion to give what we have and give what we can do to make the earth a better place to live. So I really thank you for letting me join in this forum, because this will be a proof that the partnership between adults and the youth, especially in adolescent health, is an exceptional collaboration.
Well, help me in thanking Wulan. You can see why she's a blessing.
Thank you so much.
Thank you so much to both Wulan and Melinda. Wulan for anchoring the discussion here about investing in people in the reality. And Melinda, thank you for teaching us to listen and learn. Thank you so much. It's now my privilege to invite the distinguished panel together with Joanne Carter, who will be the moderator. Joanne Carter is actually a human capital champion, as well as one of the GFF earlier CSO representative, and helped us shape the GFF from the very beginning. And Joanne is here with, as you probably know, the executive director for Results, a partner organization that is really dedicated to end poverty and also to raise resources to ensure a more equitable access to services. So Joanne, please, the floor is yours. And Joanne will invite the distinguished panelists. Kindly join Joanne here.
If you don't want to join me, we're just going to go right into a dialogue. So, I guess, sorry, the Minister from Indonesia. Not here? No. Okay. Please. Hey. Can you hear me? Is my mic on? Yeah, okay, great. So welcome everyone. That was a fantastic last session, and goes to the huge value of not just the leadership in the future of young leaders, the leadership in the present of young leaders. You know, we should never pretend that's just about the future. I'm honored to be moderating this panel with a group of leaders that are deeply committed to human capital investment and have done important work on that, and who have also worked closely with the Global Financing Facility as a critical instrument and partnership to advance increased, smarter, more equitable investments in the health and nutrition of adolescents, women, and children. And just to say, as Mariam noted, I've worked for nearly 3 decades with civil society and community advocates to support government leadership in health, nutrition, education, social protection, and other investments in human capital. That's why I'm a champion, but it's also why I've been so interested in the GFF almost before it even existed. I was kind of following the team that was putting it together, wanting to see how we could help shape that and support it because of its potential to crowd in resources for urgent health and nutrition priorities, because the potential to support countries to make their investments more strategic and higher impact, and to also bring in more partners, including civil society and communities, as real partners in moving this work forward, both helping plan and support and oversee, but also to deliver services. So we want to talk today about the opportunities and challenges for greater investment in health and nutrition for adolescents, women, and children, and the role the GFF is playing and can play going forward for even greater gains. I'm going to be asking questions for each of our panelists in turn. And I will say big apologies in advance that I'm going to ask you all big, important questions and then request that you give me your thoughts and answers in just a few minutes. But that will allow us to actually have some time to ask some more questions and have a dialogue. And I'll also say in advance, I'm going to be looking at my watch or my phone, and that's not that's nothing about disinterest. It'll just be to track the time. I'd like to start with a question for His Excellency Minister Safa, Minister of Finance for Sierra Leone. If you prefer, you can just stay in your seat. And I think we should have several mics that we can share. But thank you so much for joining us. Your country is an early adopter of the Human Capital Project. You were one of the front-runner countries for the GFF. Can you just share briefly about your plans for addressing challenges in the health and nutrition of women, children, and adolescents in Sierra Leone, and also how the GFF has and will help you? Thank you, Minister.
Hello. Yeah, thank you very much. Let me thank you for giving me the opportunity to share with you how we hope to go forward with Human Capital. For us, Human Capital is a political agenda. It was part of our manifesto. We won the elections in April on that ticket, and we are pursuing it. As recent as last month, the President launched the free quality senior education that provides free education for pupils from preschool to senior secondary school. I mean, the package covers tuition, it covers learning and teaching materials, school feeding, subsidized transportation for school-going children in urban towns. On the quality side, we're looking at school inspectorate, improving on school inspectorate, school monitoring, teacher training, and community monitoring itself. For us, the concept as a government for human capital is the entire child survival chain. It starts right from pregnancy to adolescent. We've made some gains in the area of pregnancy and birth, because as evidenced by increase in delivery done by trained health personnel, there's also an improvement in delivery taking place in safe facilities. But yet, the indicators are very appalling. Infant mortality is estimated about 90 out of 1,000, one of the highest in the world. Under 5 mortalities, 156 out of 1,000. More appalling is maternal mortality. WHO estimates it to be 1,360 per 100,000 live births. Now, what are the challenges? The challenges is that the healthcare system needs to be strengthened. It's weak, still continue to be weak. Then there's also weakness in child delivery, the service delivery chain. But more importantly, our preliminary assessment is that the entry point for addressing maternal mortality is not very correct. We rely largely on the traditional reproductive care healthcare systems, reproductive healthcare systems. But the statistics I have with us, or we have with us as a government, shows that we need to change our entry point. Currently, 2 out of every 5 maternal deaths is due to teenage pregnancies in Sierra Leone. 2 out of every 5 maternal deaths is due to teenage pregnancy. 15% of our girls become pregnant before age 15. 28% of our girls between 19 and 24 are either mothers or pregnant women. 44% of our girls married before age 18. And 44% of the pregnancy, of the girls lose their pregnancy below 20 are lost within the first 7 months. Sierra Leone ranks as one of the countries, in the first 10 countries in terms of teenage pregnancy. What does that tell us? That tells us that we have to change the course of action. We have to focus on adolescent sexual reproductive health if you have to address the serious problem of maternal mortality and infant mortality. Whilst the outcome indicators in terms of delivery in the utilization of the healthcare facilities are encouraging, the impact indicators are not encouraging. This is where the Global Fund facility can be most useful. We need the Global Fund facilities in several respects. One is to improve on the allocative efficiency of healthcare financing. Where do we start? We start with updating and institutionalizing public expenditure reviews, particularly in sectors related to the human capital. It's not just a question of increasing expenditure in healthcare. I mean, in the case of Africa, we talk about 15% in line with the Abuja Declaration. But you need to understand which areas are you spending. Then you back that one up with evaluation of core programs. That can form the basis for investment case studies. We need an investment case that we identify the problems, design cost-effective programs, deliver on those programs, and sustain the impact of those programs. The investment case is a means of prioritizing. What can we do with greatest impact, more cost-effective? That's where we need to start. There's a lot of advocacy about increasing expenditure in the healthcare, for example, but here we go as Minister of Finance. We are starting the discussions with the Ministry of Health to see which areas are more cost-effective, which area can create the largest impact. If we have identified that 40% of maternal death is as a result of teenage pregnancy, then family planning becomes imperative, logically. I mean, the figures speak for themselves. It's logical. But we need to do more to handle that. So alongside improving allocative efficiency is the issue of coordination. Coordination is key in our strategy as a government, in bringing all the partners together. Remember, impact indicators like maternal mortality are not only contingent on variables in the health sector, they are contingent in variables even in the agricultural sector. The issue of nutrition, which synergies exist among the sectors. So we need to be very clear as to which sectors will bring on board to affect the human capital indicators. Then, of course, the issue of domestic mobilization is very key. This is another area where the GFF can be very useful. I mean, we've recently increased taxes on tobacco products for 35%. It's just about 2 or 3 months old. We're trying to see, definitely that amount is going to be used for supporting healthcare. And we're thinking about getting other percentages from royalties from our minerals and divert them to special funds to promote the healthcare. We need to ring-fence percentages of some funds from obtained from other areas. The other thing we also need the GFF to do is to assist us to see how we can crowd in private sector capital. Already, there are a lot of opportunities for mobilizing private sector capital. There are schools built and managed by private sector operatives. There are schools, clinics managed by private sector operatives. What is lacking is a policy framework for public-private partnership that will respect equity, that will ensure larger coverage. We've not applied PPP significantly enough in human capital development. It's been done largely for infrastructure projects. We need to get back to the drawing board and see how we can improve on that. Finally, the other two areas again is the role of the communities and the synergies between the communities. We need to be clear what the communities can do. Communities can be very useful in monitoring even the basic things like distribution of drugs. They can be useful, even they have proved to be useful as a liaison between the clinics and the households. You can use the community health workers. Seems to be a cost-effective way of doing business. It's a new model, it's a new thinking of supporting the ANC services, PNC services, and even postnatal services. The community health workers in those communities, the health clubs in those communities, the school management committees in those communities, all can be very useful. So these are few things. In summary, the GFF, we need the GFF to support us in improving the allocative efficiency of healthcare budgets. It's not just a question of raising the money. Of course, we need them to support us in raising the money, but how do we use the resources? We need to be very clear on that. That has to be evidence. We must have the result. We must have figures to determine that. And we must look out for cost-effective, high-impact interventions. And we'll concentrate our limited resources in those areas. Thanks.
Thank you. I want to say I asked for shorter answers, but his answer was so good I felt like we had to hear it, and I really appreciate the comprehensiveness of your thinking about this, and we may come back on some of those points in a little bit later, but thank you, Minister, so much. And now, if I could ask Bill Morneau, the Minister of Finance for Canada. Canada has been a hugely important leader on human capital investment more broadly and in women and adolescents. And as a founding member and an investor and a strong supporter of the GFF, we'd just love to hear from you kind of what has motivated Canada to put a strong focus on improving health and nutrition of women and adolescents, and the investment in GFF is a key part of that. Thank you, Minister. Thanks for being here.
Well, first of all, I'm really pleased to be up here with this group and to be able to talk about this. I guess when you're in the role where you're thinking about how you can have the biggest potential impact around the world, your starting point is considering what the best mechanism to do that is. So as some of you might know, there's some Canadians in the room, we've taken a decision that we wanted to have a feminist international assistance policy. It was really just a recognition that the place where we could have the biggest impact, it would be to be focusing on women and girls, to look at the potential development impact we have by focusing on issues facing women and girls, being successful, but starting, of course, with health. So that's been an ongoing Canadian theme. we were obviously very pleased to be one of the founding partners at the Global Financing Facility, with the thought that as you think about where you're going to focus, then you need to think about how you're going to have the biggest impact. And so our goal was very much in thinking about how we crowd in other sources of funding so that any investment that we make is amplified by other investments, in particular investments from private donors, which are otherwise difficult to attract, and thinking specifically about how we can then measure metrics for improvement. So the actual thinking about how you can assure that you're actually having an impact is the final part of that. So from our standpoint, this is how we've come to, where we can have the biggest impact is about, the area we're focusing, how we can assure that we're not alone in doing that, crowding others in. And then, of course, the idea of having some metrics to show results creates a bit of a virtuous circle for investors to think about how they can continue to be there through the ongoing efforts of the focus. So happy to continue in this regard, and looking forward to more things from this group.
Yeah, thanks. And we continue to be really grateful for Canada's leadership in this area as well. I do want to let folks know that that Minister Borjigorno is delayed. He's with the President, so that's where he needs to be right now, and we'll see if he makes it. So now a question for Nick Dyer. Nick is the Director General for Economic Development and International and for Policy and Global Programs at the UK Department for International Development, DFID. So, Nick, to say a little bit about why the UK joined the GFF, what potential do you see in this model, and anything else you would want to say about how it fits into your broader frame around, obviously, the UK's strong priority in human capital investment.
Thanks very much. I thought the Minister made a really compelling case for why we should be investing in reproductive, maternal and child health. And you only have to look around the world to see why that still persists today. But actually, you only have to look at your own history. My grandfather was one of 26 children. And his mother, my great-grandmother, she died young, not surprisingly. She had no choice in her life. All her children weren't educated. And they lived a life of deep poverty. And 3 generations later, I have 2 children, and we have a very different life. And investing in helping women have that kind of control and helping prevent the impact of having so many children so quickly is absolutely essential. So we get it, and the UK government spends £1 billion a year on investing in reproductive, maternal and child health. So it is a good question, why bother with the GFF? Because we have plenty of mechanisms that we can invest in. And we do use many of those mechanisms. But we were involved in the GFF right from the start in 2014-15. And we made our first investment into the GFF this year, a £30 million investment off the back of our family planning summit. And we've done it, I would say, for one reason only. And that's about leverage. It's all about recognizing that the sums of money that is available from international development aid is never going to solve the problem. And if you want to solve the problem, you're going to have to, as the Minister said, leverage in other sources of funding, whether that's from domestic finance, from countries' own tax revenues, or it is from philanthropic organizations like the Gates Foundation, or it is from the private sector. And what we found attractive from the GFF is the concept of identifying innovative new financing models that can use a range, whether it's from subsidies, whether it's blending, whether it's using guarantees, to attract new resources into solving this problem, because collectively we can get somewhere if we do that. If you are doing it on your own, you're going to be very limited. And that's the single reason why we find it attractive.
And now for Henrietta Thor from UNICEF, the Executive Director of UNICEF, who I hope you heard in the last session. She was great. From UNICEF's perspective, what is needed to ensure the best, big question, best investments made in children and adolescents? And if you could share some of the most important kind of challenges and opportunities that you see from UNICEF's perspective. Thank you.
Thank you very much. This is a very interesting panel. I can see the threads in everyone's comments for why it makes good sense to create GFF, and it makes you wonder why we didn't create it earlier. But our particular interest is in systems, because when you listen to a young woman like Wu Lan, and she's volunteering her time, part of what she's saying is that the systems aren't working well enough to actually catch everyone. So you end up, Mulan's nodding, so you end up having to catch up. So what we dream about is that this might strengthen systems, nutrition systems, education systems, health systems, protection systems within countries. And the case is made by each one of you. Because if you can, then all of a sudden you will have the basis for which the young people can actually share their voices, tell us what they need, and we can then hopefully deliver it through the systems. So from UNICEF's point of view, we are number one worried that there are a lot of countries whose systems are very stretched. Governments are having a hard time keeping up with their transportation systems. They're having a hard time keeping up with their education systems, their policing systems, and so sometimes this doesn't look urgent and important, but it is. And so to have a facility like this actually means that you can turn to it, and that maybe we can drive more public and private funding for these systems in country. In humanitarian emergencies and in natural disasters, we see it more strongly. It does not take long before the hospital clinics are overloaded. The school systems end up having to shut down. Many of the nutrition systems are just not working. So the basic systems for water and health just begin to shut down in humanitarian emergencies or in times of violence. And that's what we're seeing around the world. We respond to about 300 emergencies a year, and that number is growing. It's very hard for governments to keep up with this. So when the World Bank began to think about forward financing facilities in innovative finance, we were able to use them for looking ahead with famines and how we can do famine prevention. It doesn't sound very exciting because people think, well, you're just investing in the systems for food, for nutrition. It is what changes a young person's life. We lose many children under the age of 5 because they are the most fragile in society. And so if we do not catch them, then it's very hard later. Stunting has a real impact on a young child. And it is our responsibility when you begin to look at our world that we take this on and that we create and leave a legacy for the Wulans of the world in which there is both opportunity for them as well as some hope. So we're excited about the facility for what it can prevent as well as what it can strengthen in the way of systems for girls, for women, for boys, and for men. Thank you.
Great, thank you. UNICEF is such a key partner, so thanks. I'm really looking forward to hearing, and I'm really thrilled that we have civil society partner here, Kevin Watkins, Chief Executive of Save the Children. But I'm also conscious that we're running a little bit late because we started late, and Minister Morneau, I know you were kind enough to join us. I know you need to leave at 6:45. So if you don't mind, Kevin, I'm just going to flip the order of questions and make sure, because I do want to particularly ask you, Minister, about how you see innovative financing tools playing a role in addressing health and nutrition and more broadly human capital challenges. We heard it from the minister from Sierra Leone looking for private capital, partnerships and other innovations. But so we'd love to hear a little bit your thinking on that and Canada's thinking.
Well, obviously, our view overall is that by providing more innovative approaches to different financing alternatives, we're more likely to attract different kinds of donors into donors or supporters or sources of capital into financing challenges. I guess one of the ways that I would look at it is thinking about how we sustain long-term interest and continuing focus from countries like Canada that want to be part of the solution. And it requires seeing, continued success over a long period of time that reinforces our long-term interest. I think about it in our Canadian context. We're trying to make an impact with Indigenous peoples in our country who have less success historically. We need to be able to show markers of success over time for people to stay engaged. And when I look at what's happening with the Global Financing Facility, by creating different tools that we crowd in, private sources, we get healthcare systems that make investments, and we do it in a system-wide way, we can actually see improvements that we can measure, which gives us encouragement that we can continue to make impact over time. When we combine that with things like the Human Capital Index that the World Bank has put out, we get to think about where we can best have the biggest impact. So if we're able to do that, if we're able to think about where we're going to have the biggest impact, we're thinking about where we're focusing on women and girls, where we can have a biggest impact on the health of a country by focusing on the places where we're going to have a big long-term impact. And then we think about how, by thinking about the financing opportunities that creates, we create that virtuous circle that we're trying to achieve. So that's really how we ensure, as a politician, I'm not really only interested in what we're doing this year, but I'm wanting to think about how we do something next year, and they'll inevitably, even though I'm trying not to have this happen, there'll be politicians after me that might not be even from my party. And we want them to sustain the effort over time. And they'll only do that if they see the positive impact that we can have, the measurable impact that the Human Capital Index today, which might show the places where we should focus, those countries, that if we make improvement, they might not be in that bottom rung next time, which gives us the next place to focus and creates a sustained effort over time from the likes of us, but other donors as well.
That's great, thank you. Thanks, really helpful. And now, Kevin Watkins, it's great to have you, Chief Executive of Save the Children. Kevin, you're a strong advocate for strengthening health systems, accelerating universal health coverage, but Save has also been really focused on driving some very specific big child health priorities like pneumonia as the biggest killer of young children. So if you could just say a little bit about how you see the GFF approach helping address both the systems that Henrietta Ford talked about, but also about, and some of those really specific priorities.
Thanks, Joanne. Look, maybe I could just start with two quick observations. The first one is that I've been to quite a lot of World Bank, IMF annual meetings, but I can't remember a meeting that I've been to that has the energy and the sense of excitement of this one, because because as a sector we do deal in a lot of bad news, let's face it, and I think there's been a lot of positive energy in this meeting, and hearing finance ministers as eloquent as you talking about the importance of human capital and even competing with each other in the human capital stakes is such a fantastic step in the right direction. So I think we do owe a debt of gratitude to the World Bank team that has brought this to fruition. The second observation is I am in the hot seat because Null was sitting here before, and so I do feel the burden of that. Joanna, I want to answer your question, if I could, with a really short anecdote. And it's from a visit I made a few months ago to a hospital in Turkana in northeast Kenya. And on the pediatric ward of that hospital, this was during the drought period, and there was something like 40 children on the ward of that hospital. About half of them had pneumonia. And I spoke to most of the parents of the children on the ward and the doctor. And there was one little boy in particular that had been brought to a Save the Children clinic, whose name was Jackson. And I spent a lot of time with his mother, who told me his story. And his story was that his mother had observed a fever, thought the fever was malaria, took him to a health clinic which did diagnose it as malaria, and treated him for malaria and sent him home. 1 week later, he came back to the clinic with severe acute respiratory infection. So he'd been misdiagnosed. His mother had actually delayed taking him to the clinic because she was worried she wouldn't be able to afford the fee. And the clinic was a great distance from her home. He was referred to the hospital that I saw him on. He desperately needed oxygen treatment, but there was one oxygen cylinder on the ward for 40 children. So this was a little boy, just under 3 years old, who'd been, had delayed treatment because the mother was worried she couldn't afford the fee, had been misdiagnosed for what is the greatest killer of children in Kenya, had been taken to a health facility that in the year 2018 didn't have oxygen to keep a little boy alive. And as it happened, he survived because of the quality of care he received. The question I think that little boy would ask is, was I the victim of a failed health system, or was I the victim of pneumonia? And I think he might answer that question by saying, don't ask stupid questions. Because this was clearly a health system failure, but this was a real disease that was threatening his life. And he ended up in that position because the health system wasn't strong enough. So clearly the health system has to be strengthened. If he'd had access to a trained community health worker with basic diagnostic tools, he could have been treated with 50 cents worth of antibiotics. He wouldn't have even had to be referred. If the hospital had been properly equipped, he would have had access to oxygen. So I think we have to stop this silly debate over vertical versus horizontal, this, that, and the other, and talk about the real diseases that threaten the lives of real children. And where I think the global financing facility is so critical is that, I think as all of the speakers have said, it's addressing the fundamental questions of how do we expand the resource envelope to ensure that the health system is properly financed. And that's largely about domestic taxation. I mean, let's be honest, low-income countries as a group are spending 1.5% of GDP on health. You do not achieve the Sustainable Development Goals in health on the basis of 1% of GDP of expenditure. So building the tax system, stopping tax evasion is a key part of the GFF remit. That, along with, as Nick has said, innovative financing can hugely expand the resource envelope. Second thing we can do, that's the first E, if you like. There are 3 E's: expand the resource envelope, strengthen efficiency. You know, in many countries, only half of the budget allocated to health is actually spent. That is a gross inefficiency at the heart of health system financing. Corruption is a huge problem. So again, the GFF can engage directly with governments in addressing these challenges. The third E is equity. And you know, we suffered for 2 decades from trickle-down economics. You know, this belief that let economic growth continue for long enough and it'll eventually trickle down to the poor. We do not want trickle-down human capital approaches. What we want is human capital models that track the disparities in child survival, in nutrition, in learning, that put in place the financing mechanisms to close the gaps between the best performing parts of the country and the worst performing parts of the country. So I would say the human capital project in its next iteration will have to have a far greater focus on equity. And I do see the global financing facility as one of the vehicles that will drive that.
That's great. Thanks very much, Kevin. That's good. Thank you. Mr. Bruno, thanks so much for joining us. Let's just give him a round, Wally. Thanks for joining us, and thanks for all of Canada's important leadership in these areas. Now I'd like to talk just for a few minutes and come back to you, Minister Safa, to talk about domestic resource mobilization, which is going to be such a centerpiece of really our it'll be the make or break of the success of increasing investments to actually achieve the targets and outcomes that we want. And not in any way to suggest that that would replace external financing, we still need that, but increasing the overall pool and particularly. So I would love to, and you also mentioned again the importance of trying to crowd in private sector finance as well. I would just love to hear from you perhaps again a little bit more about what do you see as the biggest challenges for you, but also some of the opportunities you touched on before in domestic resource mobilization for these areas. So sort of what are some of the challenges and what are some of the real opportunities there? And perhaps we can also come back to how we can help you.
Yeah, thank you. Of course, I mean, I generally agree that domestic resources have to be made available. I mean, we have to raise additional revenue. We have to allocate revenue, most of our a good percentage of our revenue to the healthcare. But the major source of domestic financing is from taxes. So that's why, I mean, I'm also in agreement with that we have to work with the tax administration to make sure that is strengthened. I mean, Ministry of Finance, naturally, as the driver of the tax policies, is well positioned to do that. But quite apart from those taxes, we have to make the extra effort. The extra effort is to ring fence some percentages of some source of revenue direct to maternal child health issues, to adolescent sexual reproductive health. I mean, for example, we have the road user tax. We say 1% of that is used for road maintenance. Because the tendency is that when the revenue is mobilized, it goes to the consolidated fund, other priorities come in. So we have to take clear actions. But again, let me just bring in this point. We've had experiences. There's evidence that higher budget allocations may not necessarily improve health outcomes. So what is the question? The first question, brothers, what comes up in your mind is the issue of corruption, as I said. That brings in the issue of accountability mechanisms. As part of the efficiency drive, we have to build in the programming, the health programming, accountability mechanisms. We have to regularly do public expenditure tracking, in addition to public expenditure reviews. Let's check where the health budget is going. If much of the health budget goes to the office of the permanent secretaries, it's not going down to the field, then there's a problem somewhere. If it's used to buy jeeps, SUVs for health workers, I mean for doctors, medical doctors who are in the Ministry of Health at the central office, instead of being in the clinics, then there is a problem somewhere. If it's used to provide doctoral training only for people, then there's a problem somewhere. We have to make sure we spend the money where it makes the highest impact. So to me, maybe probably one of the takeaways from this program is I emphasize that we have to update and institutionalize public expenditure review. It should be a process. Before a budget process starts, we must have completed a public expenditure review. Tie that one up with public expenditure tracking. The money we spend, where did it go? What happened to it? Did it trickle down from the top to that? So that we don't have a trickle down, we're not caught up in the quagmire of trickle down human capital, as you said. We have to be very clear. Then finally, as I said, as I emphasized, the accountability mechanisms. To me, that's also key. The synergies, the coordination mechanisms. Who coordinates healthcare financing? Now, the issue of the private capital. As I said, what we need first is the framework for mobilizing the private capital. That is where I see the GFF very key to support African countries, early adopters of the human capital, to support us to develop a framework, a robust framework for mobilizing private capital. There's a lot of willingness on the part of the private sector to support education, to support healthcare. After all, they are doing it all within the context of corporate social responsibility. I mean, they can do it. We just need to make sure we arrange with them. We also need to define clearly which part of the private sector including the NGOs, which part of the healthcare chain can they perform better? Should we leave hospital management to them? Should we leave cleaning of the hospitals to them? Should we leave the control of the management of the mortuaries to them? We need to be clear on those things. Because there are certain services, healthcare services, that can best be performed by the private sector. You see, but which are being done by the public sector and not efficiently done by the public sector, and probably even done at higher cost. So the business model of healthcare delivery is something we need to revisit in a nutshell.
Thank you so much. Thanks again. Really helpful. I believe the minister has arrived. So, sir, if you could, we're really grateful that you made it. We'd love to have you come up on stage and. So really glad to, we know that you were with the president, and we really appreciate your joining us, and great to have Minister Bambang Brojonegoro, who is the Minister of National Development Planning for Indonesia. Thank you for being here, but also thank you for being our hosts for this really powerful set of meetings. So if we could just grab you as you come right in and just ask you from your experience, what human capital investments have you seen to be the best buys for getting results in Indonesia? And I know that there's been a real focus in particular in investing in reducing stunting, so it would be really interesting to hear about that piece of it as well. But again, welcome, and we'd love to hear from you. Thank you, sir.
Thank you very much. Very good evening, everybody. Apologize that I joined late due to the prior commitment with ASEAN Leaders Gathering. In the 2019, next year, we already have the national priority that will emphasize on the human development. And of course, from time to time, in fact, we always pay the focus on human development. In the past, the issue will be more general on the issue, for example, the poverty, and then after that, inequality. But of course, when you are talking about poverty, inequality, the focus will be the human itself. And certainly the budget for education, health will be dominating. And currently, we notice that although our poverty rate now is finally single digit, less than 10%, on March 2018, 9.82%, but we acknowledge that the decline of our poverty becoming slow down. And we need to find out why the trend from relatively fast decline becoming very slow. One of the reasons is because we didn't pay, I think, enough attention about the stunting issue. And then we were quite shocked when we look at the map of stunting globally, in which Indonesia may be at the top 5 in terms of the country with the stunting prevalence. And with the stunting, of course, we know that although we will spend very much in education, in health, it won't affect much, because then the children with the stunting, if they are not treated properly, then they basically becomes like the development problem itself. And as a result, they might become the part of the poverty. It means the effort to reduce poverty in the future, if we ignore stunting, will be even more difficult. So that's the reason why starting this year, we have the national campaign of the stunting. And one important message of our national campaign, I think is very simple. Stunting is not just a health problem. And from the bureaucracy perspective, stunting is not just the issue in the Ministry of Health. Stunting has to be tackled by doing the coordination among the ministries, and more importantly, we need also to empower other stakeholders other than government to be very much involved. Because what government can do is, of course, having the good program, setting the budget, and disperse the budget itself. But if the public education or the awareness about the stunting itself is not there, I believe the big amount of the budget will be wasted. So that's why the national campaign of stunting now becomes our priority. And in fact, when we try to implement other programs, especially at the village level, anything at the village level, we try to connect that program with the stunting reduction. And the more difficult thing about stunting in Indonesia is not just about 1/3 of our children under 5 years old suffer because of stunting. This is the data of 2014, but the stunting, unfortunately, is everywhere in Indonesia. Not just in the remote island, remote area, underdeveloped area. It also happens in the urban area. It also even happened in Jakarta, which is the capital of Indonesia. So it means that it's not just about the health issue, it's not just about nutrition issue, but it might be linked with the issue, for example, lack of sanitation, lack of clean water, or the issue of simple public ignorance. For example, yes, they are eating properly, I mean, in terms of the amount of they eat, but they do not eat with the quality. So, for example, many children in Indonesia, unfortunately, they really like instant noodle. And of course, if you are doing the survey and you are asking, have you had lunch or dinner today? Yes, they have. But if we do not ask further question, what kind of food that do you consume, then of course you will be clueless. You might be puzzled. What happened with these children? They are eating or they are having the meal regularly, but somehow they still have the problem with the stunting. So I think stunting is really kind of the ultimate issue that the government needs to tackle in order to try to speed up, accelerate the poverty reduction in the future.
Thank you very much, Minister. Thanks. And really important work and really important focus. So as I said, we started late, so we're going to go over a few minutes into the time of the reception. We do have a couple of interventions I want to take from the floor, but I just want to close with a couple of important points that we still had in questions. So I'm wondering, Nick Dyer, if you could just say a little bit about how you would like to see the GFF or the opportunities you see the GFF expand and develop in respect to multi-sectoral investments. That would be great.
Yeah, thank you.
Anything else you want to say?
Well, the main thing I want to say is that we spend a lot of time in these kind of meetings and panels talking about problems and challenges. And I genuinely think we have a real moment of opportunity and possibility. And you know, that is driven by innovation. And there are innovations around data, the Human Capital Index. There are innovations around technology. And there are innovations around finance. And if you can combine those three innovations together, you have a really powerful tool to make progress. And I think we should aim to do that and aim to celebrate it. Now, but I think the test for the replenishment that we are just about to come to is how do you combine that sense of possibility and innovation with the lessons that we've learned from doing many of these things in the past. And we have learned a lot of lessons. And I thought, and I think that the test for success for the GFF is the extent to which it adopts these lessons. And I thought Kristalina, in her opening remarks, she picked up on three of them. And I sort of wrote them down. I was so compelled by what she said. And she mentioned three things. One was country coordination. The second was linking it, making sure we link it to domestic resources. And the third was governance. So coordination and governance and leverage are three key things we've got to see succeed. And I would add two more lessons from the past. So the first is focus. So thinking very carefully about country selection and how you deploy concessionality in a way that focuses resources on how best they can have the biggest impact. And how you can focus concessionality on the poorest groups. And this speaks to Kevin's point about equity. And I think the second thing I'd highlight, and this actually picks up on the Minister's point, is about alignment. Now, Kevin said that we should avoid these sort of binary distinctions between vertical interventions and horizontal. And I think he's right, because the stunting example is a very good example of why you can't just look at one individual treatment, but you've got to look at it across in terms of whether it's water and sanitation, whether it's education, whether it's agriculture. I mean, all these things matter if you're going to achieve and address the challenge of stunting. So, you know, I think if the replenishment can demonstrate and show that distinction and how we join up innovation with lessons, then it can be more successful.
Great, thanks, really helpful. And maybe just to close this part of the panel, maybe a last question for Henrietta Fort, which would be, you know, if you look specifically at investments in health and nutrition of women and children, again, sort of building on this multi-sectoral piece, what role do other sectors play in helping achieve the outcomes we want? And on the flip side, why are investments in health and nutrition so important for other sectors like education? So from UNICEF's perspective.
Well, the second part of your question is the easiest, which is that it's very difficult for a girl or a boy in school to really learn if they haven't had a chance at a little bit of nutrition in the morning. And it may not be the cup of noodles, Mr. Minister, but whatever it is, it really helps them to focus on their studies. And it's extremely important that they also have a nice, clean glass of water. So all of them are involved in how you actually have children survive and thrive in a country, in an economy, in a community. And if we could focus on the big areas, such as what Nick talked about, good data, good innovation, good resources, and the Minister from Canada mentioned political will, all of that maintenance is extremely important. But there are also some things just at country level one can do, such as to Kevin's point and the Minister from Sierra Leone. If a primary health care clinic, if a community clinic is too far to walk, if you are a mother with a sick child, carrying a sick child, then it's too far and you need another community health clinic. So there's some things that are just simple, they're right in front of us, and they can indicate to us where we should be working first.
Great, thank you so much. We have just a couple of, I think, a couple of interventions from the floor. So do we have a mic for our, or we can hand whatever, yep. So I think first Jens Henriksson, who's the CEO and president of the Swedish insurance company Folksam. So we'd love to hear a few thoughts from you about how to bring private sector capital in as investors and supporters of this big human development project. So,
well,
please.
Thank you very much. Thank you for a good panel. The question is, you ask for crowding in and you ask for leverage. So I'm the CEO of Folksam. We are Sweden's largest insurance companies. Today, we passed the threshold of investing more than 25 billion SEK in green bonds. So we passed 25 billions in green bonds, and out of those we invested 1.6 billion US dollars in the World Bank, and that's very good because that gives you leverage and it gives a better return to our pensioners while at the same time helping the World Bank in investing in people. So I could just recommend other participants at the capital markets to do the same thing.
It's a very powerful model, and thanks for that intervention. And then I think to close this out, we have Reina Bush, who's the Director General for International Cooperation for the Netherlands. The Netherlands has been a huge leader on a number of these key human development, human capital investment areas, especially for women and adolescents, and recently announced support for the GFF. So we'd just love to hear a few words from you. Thank you.
Thank you very much. As you said, last month our minister committed to join GFF with $68 million, which we will live up to. And why do we do it? I want to mention 3 reasons. The first one, as we heard from Wulan, is about making dreams come true for adolescent girls. This requires interventions regarding freedom of choice in matters of sexuality and reproductive health. Because this leads to empowerment, economic gains, dignity, and a future, both for her personally as at national level. Second, there is need for increased and sustained funding for making systems work, as Henriette Voor also said. Systems work for reproductive, maternal, neonatal, child and adolescent health and nutrition. It's cross-sectorial, but we need the systems make work for people. Third, it's about innovation. It's about this innovative way of unlocking new and additional funds, both domestically as externally. Because these funds will be used to build on the investment case. An investment case, as we are seeing, built on national plans which are developed in an inclusive way with multiple actors at country level, including civil society and, most important, the key populations we want to invest in. Those are the reasons that we joined GFF, and we hope this will really make dreams coming through. Thank you.
Thank you so much, and thanks for your support and leadership. So we are just about out of time, and I want to just take a moment if folks could thank our panelists, and then we're going to have Annette Dixon to close for us. So can we just get a hand for the panel? I mean, for people being here tonight, but especially for the work that they're doing in the world to drive these issues. And then I'm just turning it over to Annette, who needs no introduction except to say thank you for the role that you have been playing in driving this human capital project so powerfully. So thank you.
Well, thank you, and I'd like to join in thanking all the panelists and speakers, and especially Minister Bambang. I know you have so much going on here in Indonesia, and your presence here today, I think, sends a very strong signal about the importance of this issue here in Indonesia. For those of you who don't know me, my name's Annette Dixon, and I'm the Vice President for Human Development at the bank, and I wanted to just sort of tie the day together because we started today with the launch of the Human Capital Index. And for those of you who haven't got your copy of the pull-out chapter, please pick them up. They're outside. But I wanted to bring it back to the link between the index and what it tells us and the global financing facility for maternal, child, and adolescent health. Because I think it tells a very important story. The GFF is working in the countries that are actually the lowest in the index. And I think, as we heard today from the Minister of Finance from Sierra Leone, the challenges that the countries that are the lowest in the index, they don't just speak to the health and education outcomes. They really are the tip of the iceberg, because these are the countries where the teenage pregnancies are happening, where young women are starting their child rearing too young, having too many children, too close together. These are the young women who are dying in childbirth, whose children are not surviving until their 5th birthday. These are the children who have the countries that have the highest stunting rates. And as I think we heard from many on the panel, they have very weak systems, weak health and education systems, and many other challenges, including capacity and health capacity and governance challenges. Now, you know, we all here, I think, have been to many hospitals and health clinics around the world. And it's always very telling when you go to the room where the woman is in labour, or you go to the paediatric ward and you see just literally scores and scores of young mothers with sick children, and in many situations, these are the least resourced parts of the health systems. These are at the bottom of the line. The services for the women and children are at the bottom of the line, even within very fragile systems. So, but I think we know that, but I think that these are also the countries where we have the greatest potential to turn the situation around, because the countries that are the lowest on this Human Development Index actually need help to get on track to actually even start the development process. These countries cannot grow their way out of poverty without help on these human capital challenges. We know that countries that have been successful in what we call the demographic dividend are countries that are able to improve human capital and human development outcomes at the same time that they bring their population growth down. They slow the population growth, and at the same time they're able to increase their human capital. And that's why the GFF is so important in these countries that really need help to get on track to be able to grow their way out of poverty. So I really appreciate your attendance here today for something that's such an important issue. I stand between you and the reception, where we hope that you will stay and join us and take time to talk to each other, and also just to strengthen the commitment that we have to actually help the GFF play the role that we need it to play. Thank you.
Thanks. Thanks, everyone. Reception outside. Thank you.